ST.
A couple of big stories bubbling up from a health perspective that I wanted to spend some time on today. First of all, sad news yesterday. Luke Perry, best known for Beverly Hills 90210, passing away at age 52 from a massive stroke and getting a lot of people worried, certainly in my age range, about whether or not this is normal and what we should be doing to prevent stroke. To help get through some of this, we have Dr. Michael Crupain joining us on the phone right now. He is a medical director for the Dr. Oz Show, author of a brand new book called What to Eat When, and a friend of ShareCare, a local company that we know and love on our show. Dr. Crupain, how are you today?
I'm good. How are you?
Great. Thanks for taking a couple minutes to chat with us. I think a lot of people were really shocked yesterday about what happened with Luke Perry. Is the 50s, early 50s, is that a normal sort of age when we need to be worried about stroke?
Well, it's not normal, but it's not abnormal. So the risk of stroke increases as you get older. But about one-third of strokes happen when people who are 65 years or younger. And it's estimated around maybe 10% in people who are 45 years or younger. So
Wow.
It definitely happens. And we're actually seeing an increase in strokes in the younger age groups.
So, are there things that we can be doing from a health perspective in terms of how we take care of ourselves and those kinds of things to try to prevent this?
Sure, there's lots of things we can do. We know the risks that are associated with stroke. So things like high blood pressure are a big cause of stroke, diabetes, high cholesterol. Of course, smoking is a big cause of stroke.
Sure.
Even drinking a lot of alcohol. So eating a healthy diet, losing a little bit of weight, controlling blood sugar, and making sure if you have high blood pressure, you treat it or make sure you know what your blood pressure is.
All right. So, also, I'm curious, Dr. Crupain, is there a genetic component? Do strokes run in the family?
There's probably a small genetic component, but most of it has to do with lifestyle.
So, okay, I don't know enough about Luke Perry to know what his lifestyle was. He certainly wasn't overweight. I mean, that we saw by looking at him on television. Does past behavior, in other words, if I am pretty good now, but I used to smoke and drink and party and was a little heavier back in the day, is it too late?
Well, no, it's never too late. You can always reduce your risk of these chronic types of diseases by adopting good behaviors now. So definitely quitting smoking. If you smoke, definitely starts helping you pretty quickly, actually. Losing weight, eating a healthy diet, those things help. Luke Perry looked like he was in really great shape.
He did.
So we don't really know, what kind of stroke he had. There's different types of strokes. So there's ischemic strokes where you basically have a clot in the artery, which means the blood can't flow to the brain. And then there's hemorrhagic strokes, which means the artery kind of leaks and the blood leaks out of it. When you see somebody who goes very quickly, it oftentimes could be a hemorrhagic stroke, which are more fatal than the ischemic stroke, which is the more common kind. Those can be caused by some genetic things. So if you had a weakness in that artery or if you had an aneurysm, that could happen. We just don't know with this case. But even in those kinds of strokes, the biggest risk factor is high blood pressure. So knowing your blood pressure and making sure it's under control is the most important thing you can do.
All right, everybody write that down. Dr. Michael Crupain hanging out with us on the phone right now, medical director for the Dr. Oz Show, author of a new book called What to Eat When, and we're talking about stroke right now in the wake of this news about Luke Perry yesterday. Here's another question I have for you, doctor. Are there certain symptoms that people tend to get and maybe ignore thinking there's something else? Are there things that we should, like, I feel like I have symptoms of something all the time. I think I might be a hypochondriac, but like, oh, my finger is tingling or I've got a massive headache or I'm short of breath, but I think it's something else. So I just don't worry about it. Are there things like that we should be on the lookout for?
Sure. There's certain things you definitely want to be on the lookout for. And sometimes if they're happening to you, you might not even realize them. Somebody else has to see you and point it out to you. Certainly, if you get the worst headache of your life, like a thunderclap, like all of a sudden, that's a sign of a bleed in your brain. That you want to go to the emergency department right away. Other things like having a facial droop, you might be more subtle. So maybe if you smile, one half of your face doesn't smile. You might not really feel that, but somebody else might point it out to you. So if you see that, that could be the sign of a stroke. If you have some weakness in one of your arms or one of your legs, that could be the sign. Or if you have trouble remembering words or your speech is slurred, those things can mean stroke. So if those things happen, you just no point in taking a chance, right?
Yeah.
You should call 911 and get to the hospital right away. And what you really want to do is get to a stroke center. And those are hospitals that are specially trained to take care of strokes. They have all the technology, the latest stuff. They have TPA, which is a drug you can give into the arteries to help break up clots.
Yeah.
And they have these other things that are like a roto-rooter, like you put a catheter up into the brain and you can extract the clot.
Oh, wow.
So there's a lot we can do for strokes now, but you have to get to the stroke center.
So that's key, is knowing which hospitals have that kind of stuff and having that sort of on your emergency list on the refrigerator. So if it happens, you know where to go, right?
Yeah, and when you call 911, if you tell them you're having a stroke, hopefully they can get you to the right place.
Yeah, hopefully they know for sure. Listen, Dr. Crupain, before I let you go, there's another story that is bubbling up today about a London patient who maybe was cured of AIDS, the second person that this particular type of treatment has worked for. What's the story behind that? And does it look like we're going to have a cure for everyone?
Well, it's a really interesting story, and it's really amazing. So this is, as you said, the second person who we think has been cured of AIDS, and it's pretty complicated. But basically, HIV lives in your body, and you can't get rid of it. That's right. It gets into your immune cells, and that's why no matter how much we treat it, we have amazing drugs now, right? We have all these antiretroviral drugs,
Yep.
and we can suppress the virus so that you can't find it in the body. So people can now live with HIV for long periods of time, almost a normal lifespan. But as soon as you stop those medications, the virus comes back because it's always hiding.
Yep.
So what happened in these two patients, they had their bone marrow eradicated where the HIV was living, and then they had a transplant with new stem cells, new bone marrow, that had a certain mutation in their cells that the HIV couldn't infect it. So it couldn't reinfect, so it just didn't happen. Now, it's not really a treatment for everyone because both of these patients had a type of cancer that required them to get this bone marrow transplant. But certainly it gives us lots of ideas, and understanding the mutation that's in these cells, and maybe in the future we will be able to use that to cure HIV.
Okay, so it's not something where we're going to see, mass production of a drug or a cure in a year or 2 years, but it could lead to something further down the road.
Sure, yes.
All right, well, that's good news. I mean, sorry for these two people that they had these terrible cancers, but, great from a medical progress standpoint, I guess, yeah?
Definitely. And hopefully we'll find, in the not-too-distant future, some vaccines that work on HIV. There's lots of people working on those, and cases like this help us with that.
Help understand what works and what doesn't, yeah. Listen, Dr. Crupain, thank you so much for your input on both of these stories. We really, really appreciate